know we've known each other for a long time, and we joke a lot, you know, but it's time for a very serious conversation. Core strengthening, core conditioning, more specifically, lower back injury prevention. Man. When I was probably 19 or 20 years old, I had a tragic accident in which I herniated a disc in my low back. The disc got pushed out of position. It was impinging the nerve or pressuring the nerve. 6 millimeter protrusion on my back, and excruciating nerve pain, L5-S1, for those of you who know the lingo. My right leg completely shot, nerve pain, and I couldn't even stand up for more than a minute. It was so bad that I had no other option. I had back surgery. They went in there, they cleaned up a little piece of the disc so it wasn't touching the nerve anymore. Obviously not the best option, but I had no choice. Too much pain. For like 2 weeks I couldn't even walk. Had the surgery, and the doctor said, Rener, you know, 8 months to a year, no training. It ended up being about 10 months. Yeah, that's right, unbelievable. 10 months, no training. Nothing, not even getting down doing technique, positions, nothing. And we have students who can't even stay off the mat for, you know, a week. Joseph Cervantes can't stay off the mat for more than 1 day. And I had to stay off 10 months. I want to show you guys the rehabilitative exercise that I used to get back on the mat, and I have been using for the last 7, 8 years to ensure that I have never have these back problems again. They've saved my back, literally. And but before I show you those, I want to tell you that during those 10 months, during that 10-month period of no jiu-jitsu, I kept it very real. I did it like the Grandmaster Helio when he was 14, 13, 14, 15 years old. I watched and I watched and I watched and I watched. So it wasn't wasted time, and it was incredible. Who did I watch the most? Wild guess. Yeah, the one who had been beating up on me the most up until that point. Hito and Gracie, my big brother. Man, I watched him, and I just tried to understand him on a different level. Because sometimes when you're in the tornado with Hito, you don't really understand what's going on. It's like you're defending, you're surviving, you're doing your thing. But from the outside, the tornado makes way more sense. So I learned Hito's game, I learned his arm, I learned everything. Came back 10 months later, back fully strengthened with these exercises, and I survived against Hito for 10 seconds, 20 seconds longer than I usually do. So it wasn't all wasted time, and it was definitely, I made the most of it. But moral of the story is, you want to avoid back injuries at all costs, especially in any sport, really. You know, back problems, you know, hinder a lot of athletes in every sport you can imagine. But in jiu-jitsu specifically, right, you're grappling, you're on your back, you're getting stacked up in the guard, so you really have to make sure your back is well protected, and I'm going to teach you how, okay? So I call them lumbar crunches, right? You know how you have abdominal crunches? In jiu-jitsu, we get a lot of natural stomach workout, right? We're here, we get a lot of, we get the natural stomach, because we're in the guard a lot, so we get a chance to work the front, like bottom of the guard, bottom of the side mount, whatever, and then we don't get the same effect, though, for our low back, you know? So even though we get the stomach, the core, the front, to have a fully strengthened core, you have to work the back as well. So lower back. During my rehab phase, I went to Patty Brown Physical Therapy in Manhattan Beach, California, real close here to the academy. Patty's amazing. Okay, she was highly recommended by the spine surgeon. I went there, and man, incredible physical therapist and person, of course. Just wonderful time hanging out. So we spent like 6 months together, and during those 6 months she showed me a lot of cool exercises, and one of the main ones we did was this pelvic lift where you lay on the ball, shoulders down, and you lift your hips up. Because like right now I'm activating my lower back muscles to lift my hips like this, right? And eventually though, after a couple months, this standard pelvic lift got kind of easy for me, okay? So then I modified it with her help, and this is the exercise I've been using since then, and the one that really brought me back, I felt like really got my back 100% ready for action. And here's what it was. Instead of being flat on my back with the shoulders like this, in which the distribution of the workload is distributed over the both panels of the low back on both sides of the spine, instead of being flat on my shoulders, flat on my feet, what we did is we angled 45 degrees, okay? So one shoulder blade on the ball, wide base, and if it's your first time, it's easier to do this with the wall right here, okay? So shoulder blade on the wall, wide base. It's a fire alarm.
I thought it was a car alarm.
It's some alarm, okay? But we're gonna keep going because this lower back strengthening exercise is more important than whatever's happening out there. So this angle right here, the top leg back, bottom leg forward, 45 degrees in the shoulders, and here's what we do. We lift the hip till this is lined up. 1, 2, 3, my knee. Look, touch down, lift, touch down, lift, touch down, lift. Now, it might not seem like much, but what happened is the burden of lifting my hips up went from being both panels of the low back to just one panel, the lower panel of muscles adjacent to the spine. And by putting all the pressure on that lower panel, you get much better workout. You get double the workout for each panel. Now what you can do is sit here, you can do 25 on this side, and then you flip it on the ball, and you do 25 on this side. Look, boom, boom. That's how I started. Okay, 25, touch, boom. Notice how I'm not pushing the ball this way. I'm not doing this. Okay, the ball stays, the foot stays, the hips go up, touch the plank. Look, boom, 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 boom. Boom. You can use the wall for extra support, okay? That's level 1. Level 2 is to try to do the same thing without the wall, just using the ground, foot out, and then make the same thing happen. Look, flat. Boom. Boom. Hands up, touch down, boom. Okay? And then you can switch back, 25 on each side, okay? But what I did is I did level 1. I used the wall for like the first, month or two. Then once I got real stable with it, then I started doing without the wall, real stable. 25, 25, 25, 25. Do 2 or 3 sets, 25 reps each. And then it got to a point where, before I show you that, the most common mistake on this one is, of course, the ball moving too much, but also a lot of people complain when they first learn this about the hip and the leg taking too much weight. It's too much work for this leg right here. Like you're gonna feel it in your quads, your hamstrings, and your hip flexor here. Let me tell you, that's okay. It's part of the process, and it's what it is, okay? It's going to feel burning there because your leg's not used to this angle of movement. But once you do it for a couple weeks, you'll get in the rhythm, this will go away, and you'll feel it only in your low back, which is what you want. But what you want to do is you want to start at each level, and you want to build up the reps. So start 25, 25, 25, 25, 25, 25, build that to 50, 50, 50, 50, 50, 50, and then move up a level, okay? And then build the next level 2. Eventually you're getting 50, 50 on each side. And then once that gets too easy, maybe do 100, 100, 100, 100. Level 2 got so easy that I moved on to level 3, which is come closer to this little plank right here. And in order to increase the force of gravity on your workout, you put your feet up. 1, 2, top leg back, bottom leg forward, and you touch, boom, touch, boom, touch, boom, touch, boom. So because your legs are elevated slightly, it's much more pressure on the lower back, and or much more gravity for you to lift your hips up like that versus having your feet down, which is much easier. So start slow, build your way up, especially if you're nursing an injury. But if it's just injury prevention, you might be able to go straight to level 3 without doing levels 1 and 2 because your back is already strong and healthy. Whatever, make it work either way. Most common mistake. Come up here, bro, to the north. So I want you to see my shoulders right here. Look at the angle. It doesn't matter which level you're doing. The most important thing is your shoulders are not sideways completely. That's going to be too unstable. My shoulders are, look, 45 degrees, supine, okay, upward facing. Look at the shoulders, 45, not on your back, because then it's too much pressure on both panels. You want to target just the lower panel. You do that by turning 45. Look, touch, elevate, flat plank right here. Touch, elevate, and that rule of the 45 on the shoulders applies for all levels 1, 2, and 3. Come back over here, let's talk. So there you have it. For Jiu-jitsu, it's so important that you have a strong core, and that includes the front, the sides, and the back. The front is common, the back is not. This will help keep you safe 100%. It has for me. So incredible. This is for sure what got me back, and now my back is stronger than it ever was. So please incorporate, and whether you have an injury or not, try this, use this as part of your regular workout routine. The way I see it is the lower back muscles are like the bodyguards, like the protectors for the spine. When you're training hard and you're getting whipped around in crazy directions, especially against larger opponents, and your spine is being burdened with all this twisting and turning, it is the muscles next to the spine that will determine, or that will tense up and prevent the spine from bending in a way that is not natural for it. So if those muscles aren't developed, strong, and awake, meaning you might have a strong back, but you got to warm it up. You got to do this type of exercise here to make sure that your back is awake, ready for action. Otherwise, the spine takes all the burden, and that's when the pressure goes onto the discs that separate the vertebrae. And the disc, once they get too much pressure, it's just a matter of time before it gets pushed out of place and starts aggravating your nerve. Then you take 10 months off, and you have to do like the Grandmaster did. Just watch, just spectate, and get the most out of it. Now, this is incredible. This is the most important maintenance exercise I do, and I don't know how much more I can emphasize it. However, there is one more secret technique that I use to maintain optimum back health, and I want to share it with you guys right now. Follow me. Here we are, NonSurgical Spine Care Center, Fountain Valley, California. Gracie Academy, 405 freeway, head south, 20-25 minutes, and you're here. The place is remarkable, okay? Dr. Dave, this is the doctor right here. This is the man who runs the whole show here.
How are you?
Man, I'm so excited to be here. Explain the situation, explain the philosophy behind the NonSurgical Spine Care Center in terms of how you guys go about dealing with people's backs.
We specialize in what we call spinal decompression therapy. There's a form of treatment that uses a computerized table that gently stretches the spine out, take the pressure away, relieving your pain and symptoms and restoring function.
Right.
It improves your quality of life.
Man, and I felt this, and I felt the results. Man, lots of students from the Gracie Academy. Who comes here? Hedon comes here. Lots of students from the Gracie Academy. Had a student who recently had very bad pain in her neck. Because you guys do low back and upper back and neck area. Very bad pain in her neck. And where she was feeling actually tingling sensation, nerve pain down the arm, right? And man, she came here and probably 10, 15 treatments. So they stretched out, they decompressed the vertebrae, the discs in the spine, and it's no problem. It solved it 100%. My mom had the same exact problem from carrying 5 babies, right? All the babies. She had problems, and with her neck and arm as well. Dr. Dave saved her 100%. And man, they all come here. Professional finders, Minotauro, as I told you, Mark Munoz, who told me about this place, they all come here. They all keep it real. So this whole idea of the decompression on the discs, I think people don't understand, you know, how important, how critical it is, and how this happens to them, you know, how this happens to regular people. Gravity, just gravity alone.
Gravity alone takes pressure and pushes down. And when you fell off the swing set by age 5,
yes,
it accumulates through the years.
So any little things, you know, gravity, things of that nature, or any other forces of nature, like Hedon Gracie, who basically you deal with, and they twist or mess up your back in a certain way, and it pushes the disc out of place. It touches the nerves in the spine and in the back. And that is what causes the excruciating pain.
The radiant pain, sciatica.
And what's so special about the treatment they do here is it's not just that they're just stretching your spine apart and, you know, tearing in every possible direction. Not at all. It's very targeted stretching on this on the decompression table we're going to show you. And as a result, it takes the pressure off the specific disc that you're having the problems with. So they don't stretch anywhere but the actual problem location. And that's what makes it so special. You're going to see these tables are unbelievable. It's a 5-phase process. We're going to go through it right now, starting with the warm-up, and we're going to break down each phase. But one thing is certain. Come to the NonSurgical Spine Care Center, talk to Dr. Dave. They do a consultation, they do an x-ray of your whole spine so they can see if you have any problem areas, and then they let you know if you're a good candidate for the type of work they do here. But I'll tell you one thing. If I knew about this place before my surgery, I would have never had it. So I'm sharing because I love it, and let's go check it out. Right? Clear? Starting with the warm-up.
Okay.
This is like the warm-up phase, you know? They put this heat pad on your low back right here, and you just chill. It's like the warm-up / wake-up phase. It's one of my favorite ones. So we chill here for how many minutes, doctor?
About 8-10 minutes. Just get the muscles nice and loose, just preparing for the decompression stretch.
Yeah. So warm up. I'll get you guys back in a minute, and then I'll see you on the decompression table.
Always hearts. So this is the decompression table for the low back. Rener's all hooked up. He has a upper body harness that connects to the top of the table. He also has a lower waist harness. That's connected to this black strap. The black strap is what connects him to the machine, which it has all his information on the computer. We'll tell the machine how much weight you want to stretch him at, and it's also which level. So from his x-rays that we found, we're treating as L5S1. When we start with Rener, he started about 60 pounds, and through the course of care we increased his weight gradually, and now he's actually on maintenance program. He's feeling great. So when he comes in for this little tune-up, we stop at 85 pounds. So it's pretty comfortable. Patients usually fall asleep. We also have videos that you can watch, or they can bring the books, but it's pretty relaxing, pretty easy.
All fish have backbones. They're all cold-blooded. There are more species of fish than all the species of fish. Hold on. Reptiles, birds, and amphibians combined is what I meant to say. Oprah's narrating this right now. It's so legit. And I'm getting stretched. I can't hear you guys, but I hope you can hear me. Stretch, pull down, while the top strap holds me in place. It's just pulling right at my lower back. It's incredible. So I'll be here for 20 minutes, you guys. Keep it real. I'll see you on the other side. Now that I'm like 2 inches taller, man, they stretch me good. What is this?
This is the Hakka Med Machine. The function of this machine is to work on relaxing the muscles, also increase the circulation. So it's similar to like an electric muscle stim, but also has these little suction cups that actually pulsates. So it actually feels like a massage. Very effective, and gets the job done.
Basically, it's like putting an octopus on your back, you know, and just letting it get that circulation going. Let's do it.
And I do very well in those. I last baseball.
Phase 4. Doctor, hook it up.
So this is the Hydrotherapy Bed. This is the last part of the treatment, and the focus of this is to relax the muscles even further. This table is filled with 50 gallons of water, all heated. Underneath are big water jets that's going to run the course of Rener's spine. What it feels like is like a jacuzzi without getting wet. Very, very comfortable, and everybody loves this one.
Yeah. No doubts to that. Hit it up, bro. Let's go. Let's fire it up. Man, that waterbed is something else. I need to get one of those. Phase 5, final phase.
This is the ice pack. There you go. Nice cold one. Put the base feet back.
They even give you an ice pack. And you just wear this all the way home while you're driving, and you have nothing to worry about. And then you bring it back next time, otherwise they choke you. That's why he does Gracie Jiu-jitsu. Listen, so Dr. Dave, very simply put, you guys, if you have back problems, lower or upper back, neck area, come down here, they'll check you out, x-ray, full consultation, basically explain the whole process to you guys. How much?
Through, since it's through the Gracie family, mention their name, we'll waive all charges for the visit. That includes the tour of the facility, x-rays, see one of our doctors who review the x-rays and see what's going on with your back.
They do a great explanation of the whole thing here, more thorough than what I just gave you guys right now. One thing is certain, if you have back problems, the Non-Surgical Spine Care Center will help you get back on track to where you were. And if you don't have back problems, they'll make sure you never do. So that decompression, my back is fine right now. I just come here a couple times a month for the, the decompression, the disc rehydration as they call it, to keep those discs fluid and safe. And Hedon does the same thing, just maintenance therapy, so to speak, to keep the forces of gravity, away from doing their thing. So please come check them out. Dr. Dave, any last words?
Come check us out. We'll take care of you.
Done. We'll see you on the mat, or we'll see you here at the Non-Surgical Spine Care Center. Thanks, guys.
Thank you. Thanks for coming. Awesome.